Hi, this is Jessica Rodman with This is Laramie, here with John Jacobs, family nurse practitioner at Grand Ave Urgent Care. How are you, John?
I'm good. How you doing?
I'm good. Thank you for agreeing to this interview.
No problem. Thank you for coming.
Yeah. How long have you been an FNP?
I've been FNP about three and a half years.
And what was your previous experience?
I worked as a nurse for about 10 years before that. I worked pretty much all over the United States. I worked a lot in the Steamboat Hospital and worked pretty much every position available to me there. And then at that point moved into travel nursing, which allowed me to work at multiple different hospitals throughout the Northeast and a little bit in Denver. So I kind of bounced around to different places and then got a lot of international experience during that time.
What kind of international experience did you gain?
I regularly work in Port-au-Prince, Haiti, usually once, sometimes twice a year. I've been very busy this year trying to build this place, but as soon as we start getting back to a regular functioning business here, I will move on to working it there at least once or twice a year.
Oh, fantastic. And why did you choose to create an urgent care in Laramie?
I think the need was here. There's less and less primary care physicians. There are busier and busier clinics in general here. And we felt like there was a need to bring a new, big, clean facility that would allow us to not necessarily rush through patients, but see a lot of patients in a short period of time.
Exactly. How does this urgent care differ from the ER or the downtown clinic?
Downtown clinic is not a for-profit industry. And it's not that profit is our motivator, but we do want to bring somewhat of a retail side to this. We want to have a very comfortable, big, open facility. Our equipment is relatively state-of-the-art. We've got a brand new all-digital x-ray machine. The hospital grade HVAC system should keep our staff as healthy as possible, should keep our waiting rooms feeling as clean as possible. The whole design was laid out to make it a easy flowing environment. It's big, it's open, and it's all essentially new stuff ready to take care of the patients of Laramie.
And you mentioned an x-ray machine. So what kind of procedures or services does this urgent care provide?
We provide a variety of services. We are all nurse practitioner run, so we try to keep to things that belong in an urgent care, whether it's a strep test or a flu shot or a flu test. We also do suturing. We've got two very well laid out, very large procedure rooms. We've got a casting room that's right off of our x-ray machine. We have everything that we can to provide typical urgent care and then a little bit more.
And when you say procedures, what type of procedures do you expect to see in urgent care?
We do a lot of suturing, and we don't want the real drastic semi-surgical sort of things. We want the very, you cut your hand working on your lawnmower, you cut your hand working on things that you do in Laramie, cutting your own firewood, those sort of things. We'd be happy to see you. We expect to see a lot of injuries out of the snowy range. Those sort of things we are ready for. We can do small skin biopsies. We can do incision and drainage of abscesses for smaller infections. What we don't have is things like a CAT scan. So if you're in a major car accident and your neck hurts or you lost consciousness, you're probably better off in the emergency room. And that kind of goes back to your question of how we differ. We want to work in conjunction with these places and not against them.
So if a patient comes to see you and you assess and you treat, will you provide referrals to other practitioners?
Absolutely. We really want to do the best we can to branch out to other practitioners in the area, whether it be nurse practitioners or doctors, and other referral services. As we grow and as we become part of the Laramie community, we really want to work with people, not against them. But we do want to provide off-hours care for, if your pediatrician is closed at 5:30 on a Friday, well, we're open for a couple more hours, and we'll be happy to see you. But at the same route, we don't want to be your pediatrician. We don't want to be your primary care provider. What we want to do is help you when you need it.
Right. So for those people who have an agonizing tooth pain, do you also provide dental care?
Very basic dental care. We, again, are not dentists. We don't claim to be, nor do we think that we should ever be a dentist.
But if their dentist is after
Sure,
hours.
after hours and a Sunday afternoon, we can provide a dental block to take care of the pain. If there is obviously an infection causing this discomfort, we'll be happy to put you on an antibiotic. We also want to be very particular about who goes on antibiotics. There's a lot, the CDC, there's a lot of other organizations that are against overprescriptions, and we don't want to get into that business either. We want to care for people what is most medically appropriate.
And as a nurse practitioner, you are allowed to prescribe medication.
Absolutely.
Are there any other limitations that you have, or?
It's always state by state, but the limitations in Wyoming are fairly limited. There aren't many things that separate us from what a primary care provider could do. We are all very much trained in the sort of procedures, and the medications that we'll be prescribing are very specific to urgent care, but we are within our realm very qualified.
So everybody can feel comfortable going to a nurse practitioner instead of strictly going to an MD.
I would agree that that's the case. Obviously, we're not going to start performing surgeries. If you have to have your appendix removed, please go to the hospital.
You will provide
that's
that
what
referral.
They do. We will be happy to try to figure out who needs that and put them into the system. We want to be the entranceway. We don't want to be the end everything of healthcare in Laramie. We want to be a new way to get into the system as you need.
Fantastic. And along with prescriptions, do you have an on-site pharmacy?
We will. We have not opened that up yet, but we have everything set up so that we can dispense simple medications. And again, we don't want to go in competition against Walmart or Walgreens, but if it's 8 o'clock at night and you've got a screaming child and one that looks exhausted because their brother or sister kept them up all night, we will be able to have you just go home with amoxicillin. Those sort of things. Things that just as a convenience thing.
Right. And you just opened on Monday, correct?
Correct.
How long did that take you to plan and to set up and to even think about running an urgent care?
It's been about an 18-month process for me. I've been thinking about running an urgent care for several years now. I worked originally with CVS and their minute clinics just because I really respected their model. It appealed to me with the difficulties of getting entrance into the system, the people not knowing what it's going to cost when they go into a hospital. I wanted to be as transparent as possible. So I kind of modeled that, and then that also paralleled well with the international work I was doing, where we did a lot of mobile clinics and a lot of very busy clinics in very poor areas. So we get all these patients in, and urgent care kind of fills into that. So when I built the layout of this design, a lot of that parallels. It's big, it's open, it's easy to clean, and there are pathways through so that many people can come in and not feel like they're being rushed through the system, but at the same route, they won't be waiting in my waiting rooms for too long.
Yeah, obviously you seem like a very open and warm person.
Thank you.
I think most people have anxiety about coming to their primary care physician. So what other services can you provide patients who are feeling any kind of anxiety? Or like myself, I decline going to medical services unless absolutely necessary.
I did my best to make it a warm, home, natural country feeling place. It's a big open facility. We have a lot of natural lighting. We're doing our best to make it a comfortable place for people to come. The practitioners that we have are all emergency room trained, but they are also, I chose them mostly because of their personality. We see similarly on what we think should be prescribed. We're very similar in the way we interact with people. We like to interact with people as people, not necessarily just as patients.
Oh, that's so refreshing. Sometimes doctors, I feel, just want to see patient after patient, and they don't necessarily have the time to talk.
Yeah, and we will staff so that we have the ability to talk. We will staff so that we have the nicest, friendliest staff available. We open this for Laramie, not just for more patients.
Great.
We wanted to open it for the community.
Great. And how many do you have on staff right now?
There will be 4 of us. One will be starting as an RN, and that's Aaron Wright. He will be starting as an RN and will soon be passing his nurse practitioner boards, and then we'll be working full-time. I will be here full-time, and Jesse Henry, who is working today, you may have met him.
Yeah.
And as you can see, very friendly, nice guy.
Yeah.
And then Christy Young will also be coming with us. They are full-time at the emergency room here in town, but will be working with me part-time.
Awesome. And on your website at grandavenueurgentcare.com, It mentions that you also provide occupational physicals and services.
Yes, we are concentrating very hard on the occupational health side. We have a separate nurse who is most of the time will be working fully with the occupational health business. We have a bathroom that was set up to DOT spec for clinical screenings. We have an entire gym that we're just developing now that we can use for the occupational, whether it's a gold mine, for example, who has heavy lifting and push-up requirements for their patients, or people who need blood work and chest x-rays. We can provide all of that on site.
Wow. So you are very much an all-encompassing facility here.
All-encompassing as an entranceway. There's a lot of things we
course.
do have interest in. We are developing an asiatsu massage room because it seems to be one of the best alternatives for back pain.
A what?
Asiatsu massage, where your massage practitioner has bars on the ceiling that allows them to use their body weight to get deeper, like deep tissue massage.
Oh, okay.
It's an Asian derivative of kind of a deep Swedish massage.
Great.
But it allows for bigger guys, it really allows for a deeper penetration. So we have massage on site. We are going to have acupuncture and Chinese medicine. And we want to do everything that we can think of that is entranceway into the healthcare system. We're not going to start doing surgery. We're not going to do things that we think are beyond our scope of medicine. We don't want to do things that we don't do well. We want to do what we do well.
Fantastic. Well, I'm very fascinated about this new business that you've created. I feel like this is going to be a good benefit and an asset to Laramie. So thank you so much for setting this up.
It's my pleasure.
Is there anything else you would like to add?
I think we are here for Laramie, and we look forward to seeing you all. Whatever we can do to help you.
Great. Thank you, John.
Thank you.
This is Jessica Rodman for This is Laramie with John Jacobs, family nurse practitioner at Grand Avenue Urgent Care.